Thank you so much for inviting me to talk today about sonography education in Europe. I'm absolutely delighted to be talking at your conference, and hopefully you'll have some questions at the end so we can discuss these. So I'm going to introduce some of the differences in the role of the radiographer in ultrasound across Europe. I'm going to talk a little bit about ultrasound education and training and think about some of the priorities for career development in ultrasound. So, what is a sonographer? A sonographer is a non-medical practitioner who undertakes ultrasound scans. So this is not a doctor. In many cases, this is a radiographer, it might be a nurse, a midwife, a physiotherapist who've had extra training in ultrasound. So why do we have the role? There's a national shortage of radiologists in lots of European countries. We have a lot of data about this and a national shortage across the world. And in terms of ultrasound activity, we're scanning more and more patients every year, as you can see from this chart. This is data from England only, but you can see that the increase is quite noticeable year on year, and this is non-obstetric ultrasound only. So what is the radiographer's role? Radiographers undertake ultrasound in some countries, but not all countries across the wider European Union and also across the world. And the range of practice of ultrasound also varies across the world. So to try and put this in some sort of context, I want to talk to you about some surveys that we did as part of the European Federation of Radiographer Societies. So we did some online cross-sectional surveys in 2019 and 2020. We talked to the national societies, we asked individual radiographers who do ultrasound for their views, and we also talked to education providers. We used descriptive statistics and theme analysis to get those results. So we had responses from 561 radiographers in our individual radiographer survey, and that covered 58% of the European Federation of Radiographer Societies. The majority of respondents were from the UK, Ireland and Spain, so thank you to anybody who actually responded. That was really helpful, thank you. A lot of countries that do have radiographers undertaking ultrasound. 4 countries were very definite no's, and then there were varied responses from these other countries that you can see down here. Now Spain was one of those, where 81% of respondents said that yes, you do have some radiographers doing ultrasound, 17% said no, and 2 didn't know. When we asked about report writing from the national societies, you can see that only 2 said that there were full interpretative reports and that the radiographers could ask for further tests or refer to other clinicians. When we asked individual sonographers, radiographers, in Spain, 1 said they do this, 1 said interpretative reports, 4 agreed with the National Society and said they do a descriptive report, others used checklists or did not write a report at all. When it comes to extended role, there was quite a big difference in the results between the UK and non-UK countries. So I've separated those out. Most people, certainly in the UK, do communicate the findings with the referrer, but less so in non-UK countries. But when it came to talking to the patients, it was a very big difference between the UK and non-UK countries. Most departments, most radiographers who do ultrasound do teach other members of staff. Interestingly, less are involved in auditive practice, leadership and research. But then when we look at Spain, interestingly there, more radiographers are involved in ultrasound research than in any other country that we had results for. So very, very interesting data there. So in terms of why are we interested in these wider skills and wider practice, Partly because if people are involved in research, audit, developing their skills, they're going to improve the service, which leads to better patient outcomes and better patient care. But also, it helps the radiographers to have a better career development framework. It gives them more opportunities to have a very interesting career and be able to progress their skills. So I want to move on to education now, because I think it's really important that we think about how is education underpinning those skills and the knowledge that sonographers need to be competent and good at their role. So in the surveys that we did, there were very different levels of education across the EFRS countries. There were some countries that had very short courses that taught people ultrasound but didn't assess whether they were competent. So it might have just been that they were giving them some underpinning knowledge but without clinical experience. There were then focused courses that led to some element of competency. So in the UK, we have people that do aortic aneurysm screening as technicians. They are not radiographers, they just learn to do that and that's their role. We then have some radiographers who might just learn to do maybe fertility scanning, and nurses who are just doing fertility scanning, so they're just measuring follicles. We have some radiographers who just measure pre and post-micturition bladder residue. We then have postgraduate courses which are for radiographers who want to do ultrasound when they've qualified. These might be full-time and they might be part-time. We also have postgraduate direct entry programs, and there's 2 of these in the UK where people come with a degree already, maybe in a science subject, and then choose to do ultrasound as their profession. So they don't have a healthcare background when they start. Some people in Europe learn a little bit about ultrasound as part of their radiography award. But we also have some undergraduate direct entry programs where people come straight from school and learn to do ultrasound. So that way we're increasing the workforce without taking it from other professional groups such as radiographers. I'm not going to spend long on this slide, but just to let you know that the EFSM have some levels of training for ultrasound practice. Level 1 is point of care ultrasound, level 2 and level 3 are where people are undertaking much more ultrasound, and to the point that they're actually pretty much most of their time is undertaking ultrasound, and that's the level that I think sonographers in the UK are working at. But it's very clear in their guidance that anybody who is providing that service is ethically and legally vulnerable if they've not been adequately trained. So it's so important that anybody doing ultrasound has proper training. So what is the minimum requirement to do ultrasound? I know you've got lots of talks today about physics and safety and artifacts, and that is really important, because if you don't know how ultrasound works, you don't know how to drive your machine and get the best from it, and you don't know what the implications of artifacts are, then you're not going to be a safe sonographer. You also then need the professional issues, and this is about the role, what is the scope of practice, what can you do within your role, what legally should you be doing, what are the implications of doing the job as an extended role radiographer, what level of reporting can you do, who do you need to refer to if there's a complication, those kind of issues, as well as things such as ergonomics to make sure you're practicing safely. We've then got communication and person-centred care. You can't learn to do ultrasound without learning to communicate properly and make sure that the patient understands what the scan is about. There's obviously a really strong need for good knowledge, understanding of normal appearances, anatomical variants, and a good range of pathological findings in ultrasound, but also then how do you interpret those findings, and how does that interpretation link to a clinical pathway? So for example, if you're scanning and you find a renal tumour, the interpretation of that renal tumour is, oh, there's something suspicious here, it looks irregular, it looks like a renal tumour, it looks like it could potentially be malignant, I need to look at the renal vein, the IVC, I need to look at the liver for spread, I need to look for ascites, pleural effusions, lymphadenopathy, and actually then I need to be able to refer this patient for further imaging. So the patient would go for CT potentially for looking for spread and to characterise the lesion. So all of those are the underpinning knowledge and skills that are needed. And finally, but not least, is clinical competency. This is absolutely crucial to being a safe ultrasound practitioner. You have to be safe, you have to be competent, and you have to know your limitations. So those are the things that are really essential in any education program.